The CDC is roiled by debate around COVID-19 vaccines, and now President Trump is weighing in. The president posted last night that the public health agency is being, quote, ripped apart over the shots developed under Operation Warp Speed in his first term. He's also demanding drug companies prove the effectiveness of the vaccines to clear up this mess. These are President Trump's first public comments about the CDC since its director was abruptly fired last week amid a dispute over vaccine policy. Joining us now to discuss is former CDC director in the Biden administration, Dr. Mandy Cohen. Thank you so much for coming on, Doctor. You were among the group of 9 former CDC leaders who published an opinion piece yesterday arguing that RFK Jr. is endangering every American's health. Someone may read that and dismiss it as an exaggeration. Why is it not?
Well, I joined with former CDC directors that have worked for presidents going back to the 1970s under different parties. And this is a warning saying this is different. What we are seeing right now is not business as usual. It is incredibly unprecedented. And we are issuing a warning to the American people. And I'm heartened to hear the president talk about vaccines and all of the millions of lives that they have saved under his leadership with Operation Warp Speed. And we want to make sure that Americans continue to have access to effective vaccines.
But now it seems like while he's praising it, he's also questioning it now. Does that concern you?
Well, I think this is a wake-up call for all of us to make sure we are heeding this warning that former CDC directors are making and to take action. The secretary is going to be in front of Congress later this week, and I hope they're going to ask him some hard questions about what is going on related to the evidence-based decision-making. Now, look, we can all disagree on policy decisions, but we can't disagree on the science that goes behind them. And so I hope this is not just a call to Congress to act, but also to the states to make sure states are doing what they can to protect the health of Americans. And we know our medical professionals are working every day to do that as well. I want to remind folks to make sure you're talking to your doctor about how you can keep yourself and your family healthy.
So as you know, vaccine policy is a major point of contention between these former CDC directors like yourself and RFK Jr. As you point out, the current commissioner of the Food and Drug Administration, Marty Makary, is actually out with his own opinion piece in the Wall Street Journal and argues drug makers have not justified the need for COVID vaccines for people under 65 without certain health conditions to get it. What do you say to him?
So we have seen around the world that the United States is the only country that is narrowing the access to these vaccines. Now, other countries may say, hey, we want to prioritize those over 65 and those who are at highest risk, but the vaccine is available to everyone. And the fact that we narrowed that availability here in the United States is very out of step with where the rest of the world is. And so we wanted to issue a warning as former CDC directors to say this is unprecedented, and we want to make sure that others like Congress, like states, like our medical professionals are stepping up to protect the health of our country.
And Marty Makary in his op-ed said, look, if you still need the vaccine, you can get it off-label, or a doctor can prescribe it to you in certain circumstances. And he also points out that his agency's current regulatory framework around COVID-19 vaccines, quote, brings the U.S. in line with peer nations like France and the U.K. And he continues that although the world has moved on to a risk-tiered approach, some in the American medical establishment are maintaining their blind faith in a strategy of boosters for all perpetuity. What is your response to that?
Well, one, I do not agree that it brings us in line with the rest of the world. And in fact, you can look at the way that our drug companies in the United States are asked to label the vaccines here is different than what they do elsewhere in the world. And I do think we should be prioritizing vaccines for those at highest risk. It is what we did during my tenure as CDC director as well. But what was most important is to make sure that the science is driving the decision making. And I think that is what is of greatest concern concern here. And what we're seeing by the firing of their own handpicked leader just 3 weeks after she got congressional approval and confirmation, and seeing the resignation of senior leaders. These are tenured folks that were rebuilding the agency, learning lessons post-COVID. The fact that we lost that talent is incredibly concerning.
Should RFK Jr. resign?
Look, I think that is a question for the president, but I think you can see by the fact that former CDC directors all joined together, we are saying that we are very concerned about what we are seeing. We want to see a change. I think it's possible to right this ship, but it needs to be changed now. I think Congress, with its oversight, can do that. I think state action can do it. And I think the president, trying to understand the data behind vaccines, can do that as well.
All right, Dr. Mandy Cohen, thank you so much.